Hi guys. So the topic that I chose for my speech is the importance of being tested for diabetes. According to Wikipedia, definition of diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired. So pretty much your body's not even, it's either not producing any insulin or not producing enough insulin. It also results in abnormal metabolizing or breaking down of carbohydrates, and it increases their levels of glucose, which is sugar. Some people also see blood in their urine. There are four major types of diabetes. One is gestational diabetes, which is found in women who are pregnant. The other is prediabetes, which is someone who's in the border of either becoming a full diabetic and not being diabetic at all. I'll explain further in the speech how you would detect if you are a pre-diabetic. Then there's type 1 diabetic, which is the condition in which the pancreas doesn't produce little or no insulin. And then type 2 diabetic, which is a condition that affects the way your body processes your glucose, which is sugar. There's ways to knowing, like early signs to knowing either one, if you are diabetic, or maybe you should just be tested. Normally, people who are tested are usually 45 years old, and they don't even have any common signs of being a diabetic. It's just something that normally people would just test for at 45. If you do have any of the following symptoms, you should be tested for diabetes, which is frequent urination, always feeling thirsty, drinking a lot, feeling hungry, having fatigue, having blurry vision, and then you just have like cuts that commonly don't heal correctly. Maybe they blister and it's not healing properly, or the wound is not closing. First thing you should always do is contact your primary care doctor. It's an easy blood test. There is ranges. The name of the blood test is called hemoglobin A1C, which is known as your sugar hormone. That's what it detects in your blood. There's a number that ranges from 2.7 to about 5.7, which is all normal ranges. When you go above about 5.6, 5.7 to like about 5.9, that generally is a pre-diabetes range. And anything above that is within diabetic range. Generally, if you become a diabetic, your primary care doctor will then possibly send you to an endocrinologist, which specializes specifically with diabetes. Once you find out if you are a diabetic, ask questions. It's always good to be knowledgeable on your own disease and your own body and what's actually going on. It's questionable. You don't know what's going on. You want to know what's going on. You want to know why you're diabetic. Sometimes it's inherited. Sometimes when you have family members or, family member having a diabetes in the family, that would cause you to possibly have it. So it's not something that you did wrong. It's just something that's inherited, and it's just something that you can possibly get. Another point is also educating yourself, asking questions. Always know that you're not alone. You're not the only person who's a diabetic. There's millions of people out there who's diabetic. There's also people out there who don't even know that they're diabetic. There are support groups that come together in different places. They have some in the hospitals. They have some in medical groups. They get together once a month or twice a month to discuss like any questions that you have, any things you want to ask. Some people don't know what to eat, what not to eat when being a diabetic, when being a pre-diabetic. There's certain things that you shouldn't be eating and things that you should stay away from. The differences between type 1 diabetic and type 2. Type 1 diabetic roughly they don't produce enough insulin or don't produce insulin at all. According to an article that I read, it's a Healthline article, the symptoms show fast if you're type 1 diabetic, usually within weeks. And sometimes it develops in childhood ages, adolescence ages. This is why you should be tested, because generally the doctors will actually do a blood test on you when you're about roughly 45 years old. But if you're a child and you're having these symptoms, then it's easily tested and be detected at an early age as well. Sometimes the body confuses the body's healthy cells with bad cells, and then it attacks those healthy cells. This is what happens in type 1 diabetes. Roughly, type 1 diabetic patients have to be injected with insulin sometimes daily, sometimes weekly. It depends on what your primary care doctor or your endocrinologist has prescribed as far as like a method for you. With type 2 diabetes, your body just doesn't respond well to insulin. According to the Healthline article, you may not even show any signs that you're type 2 diabetic. But once being tested and finding out that you are diabetic and then you are type 2 diabetic, you don't necessarily have to inject insulin. Sometimes there's pill forms that can help regulate your A1C, the hemoglobin A1C, as I mentioned earlier. I just want people to know that if you are indeed a diabetic, you're not alone. You know, there's, like I said, there were support groups. You may not even know, but you actually may have a friend or family member who actually is diabetic that you kind of go and talk to and see what their methods were on dealing with this disease and furthering getting more information about it. So the first thing you should do, once again, is contact your primary care doctor if you're having any of those symptoms: urination, blurry vision, fatigue, always feeling thirsty, constantly urinating. So if you're scared, know that it's okay to be scared, but know you're not alone. All right? And that's all I got for you guys today. Bye.